2010, that was when the Affordable Care Act was passed, and you'll see here, this comes from the Kaiser Family Foundation. They have a lot of data on healthcare, health plans. So as you can see, deductibles are up 111%, family premiums are up 55%, significantly outpacing workers' earnings and inflation. So again, presenting those renewal increases, when businesses are faced with some of those increases, what do? Do I raise deductibles? Do I cost shift and ask my employees to pay more? Do we let those increases eat into the profits of our organization? Do we look at narrow network options like HMOs, where now we're reducing access for our employees? Or do we have to, our increase is so great that we need to do a combination of everything? But what we do know is that the employee's perception usually around open enrollment is how much more am I going to pay and how much less in benefits am I going to get? One of the statistics that really stands out to me, two of them, is the number one reason the number one thing that people have to file for bankruptcy for in America is due to healthcare related expenses. But the one that's the most surprising of the people that had to file for bankruptcy, just about 2/3 of them had health insurance. So now it's kind of that perception, can't afford to have it, can't afford not to have it. So just trying to change the trajectory on that. But I often get asked, so Colton, who do we point the fingers at? And I think there's a lot of blame to go around, whether again it's the large hospital systems, the pharmacy benefit managers, big pharma, all these different pieces of the pie. But let's just blame these guys for now. As you can see, during the same time period, I don't think the insurance carriers are hurting much, are they? These are their stock prices. So these are just some questions to think about. A lot of groups that we talk to, they are on a fully insured basis working with one of the big carriers, as we refer to them as BUCA carriers, Blue Cross, United, Cigna, Aetna. A lot of times, we just had a conversation with an employer yesterday, have you ever, you pay your month-to-month premiums, but at the end of those 12 months, have you ever received any of those dollars back? Blue Cross probably isn't calling you and saying, hey, you guys did awesome on your plan. This year we're actually going to write you a check and give you those dollars back. Oftentimes that's not happening. And then what safeguards do you have in place to protect your plan from high-cost claims? That is a big portion of it. One thing that I failed to talk about on the previous slide is also with the Affordable Care Act was passed, there's this thing called the medical loss ratio, which basically says that for every dollar you pay in health insurance premiums, 80 to 85% of that has to go towards paying claims. So these health insurance carriers look at that 15 to 20% and say, well, how can we make more money? Well, we can inflate claims, we need to raise premiums, because then our piece of the pie gets bigger. So now they have no incentive to reduce your costs. All they want to do is just increase costs, so then they can make more money. So hopefully trying to teach you a way to combat some of that. But then there's that 80 to 85%, the claims. A lot of individuals that we talk to, they talk about raising deductibles or adding different strategies that really aren't addressing the claims, or maybe even jumping from carriers to carrier. But you'll find here, just with some of the components or cost containment mechanisms that you can put in place, it's really trying to drive down the claims as much as possible. As you'll see on the title slide, how to pay less for health insurance by paying less for health care, and that's what we need to do. And then what would your employees think if you were able to have these high cost claims paid for with no out-of-pocket expenses? Getting that new hip replacement, or that new knee, or getting that MRI, or that very costly specialty medication, where we can get them in a situation where we're saving money on the claims, that we're able to pass off some of those savings to the employees where they have no out-of-pocket expenses. And then last but not least, how are we empowering employees with cost and quality information? We talked to an employer yesterday that they are starting to run out of rungs on the ladder. They've moved to high deductible health plans with an HSA, but they're just like, our employees have no tools to shop around or look at cost and quality Because unfortunately in the healthcare world, not all physicians are created equal, and not all facilities are created equal. So it's very important to know where those high value or low cost, high quality providers are. So step number one is just trying to put you in a funding position that is going to benefit you and not the insurance carriers. So oftentimes we're talking to a lot of our clients or prospective clients about self-funding. There's multiple ways to self-fund, whether that's traditional self-funding, level funding, there's self-funded captives out there. And sometimes self-funding gets a bad rap, but there's a proper way to do it, and then there's an improper way to do it. But this kind of goes back to my example. A lot of groups are fully insured. You're paying a carrier 12 months worth of premiums. No real data into, or very limited data into whether did we overpay for our premiums or did we underpay? Are we getting any dollars back, or are our overpayments basically staying at the carrier's bank account? So being able to put you in a position that as we deploy some of these cost containment mechanisms that we're going to get into, at the end of the year, hopefully we have a good chunk of change in there that is coming back to your business that you can utilize to give your employees a premium holiday, offer additional benefits. We spoke to another employer that they are very much big into wellness, and they rely on certain grants. So this would be an opportunity for them to use those dollars for wellness benefits. So self-funding is definitely number one. That gives you control, and it gives you transparency into your claims, because we need to know what those cost drivers are, that 85% of your spend. And if we have high pharmacy claims, okay, how can we decrease those pharmacy claims? Do we have high emergency room visits? How can we decrease those high emergency room visits? So I like to simplify things as much as possible, and in any normal health plan, you got 4 areas of your health insurance plan. You got inpatient, you got outpatient, you've got primary care, and you've got pharmacy. I like to talk about the pharmacy first, just because that is the largest and fastest growing right now, just with a lot of innovations and new specialty and brand name medications coming to the marketplace. If you talk to some of your insurance carriers, they're probably talking about how much pharmacy is impacting them, and maybe you're getting access to claims. I mean, there's some drugs that are $10, $15, even $25,000 a month that some of these employees are on. And so we've got some different cost containment mechanisms that we can deploy in that area. And then hospitalization, and then outpatient surgery at 20%, and then primary care at 20% as well. And as Lee mentioned, we've worked together now on the primary care piece, and I really see that as one of the most important pieces, just because employees and their families just need access to good primary care. That's same day, next day appointments. It's unrushed appointments, because with good primary care, hopefully that means less medications. As you can see on those testimonials, people are coming off medications, less emergency room visits, less inpatient surgeries, outpatient surgeries. One of the largest cost drivers too, outside of cancer and things like that, is MSK, or musculoskeletal. Because as you can see with the chart that Lee put up, there's people are carrying around more weight, means they need to get new knees, new hips, shoulders, things like that. So as I like to say, there's an app for that. With your phone, there's a solution for that. So as costs continue to go up, there's probably some sort of cost containment, or what we refer to as point solutions, out there that you can take advantage of. So I'm going to start on the pharmacy piece. So this is RX supply chain management, and you'll see here, these are 32 ways that pharmacy benefit managers can hide revenue. And that's pretty eye-opening, because a lot of these employers that we talk to, why are my costs going up? And you talk to a lot of independent pharmacies, they hate PBMs, or pharmacy benefit managers. And there are over 300 pharmacy benefit managers across the country, and there's more that are popping up daily, because there's so much money in pharmacy benefit management. Their sole purpose is to try and procure medications for your members at lowest cost. Well, they've found significant amount of ways to hide revenue and keep a lot of those dollars for themselves. You'll see here on the next slide, these are just some of commonly prescribed medications. So step number one, trying to find a pharmacy benefit manager that what we like to refer to as transparent and pass-through. Pass-through means that they're passing through rebates because there are drug manufacturers out there that manufacture drugs. It is the PBM's purpose to negotiate with those drug manufacturers, but unfortunately they're in cahoots with each other, so they say, hey, drug manufacturer, I want to put my drug on your formulary for all of your members, and by you placing my drug as the preferred medication on that formulary, we'll give you a rebate. And so those are dollars that should be passed through to the employers and your members, but are actually kept by the pharmacy benefit manager. And this can equate to hundreds of thousands of dollars depending upon your group size. So with one of the things that we do is find a fiduciary PBM that's going to work on behalf of your members and not on behalf of themselves. And that are also taking advantage of programs like manufacturer's assistance, patient's assistance, or even international pharmacy. You'll see the stat here that's right across that line. We pay 16 times more in prescription drugs than any other tier 1 country. So that would include Canada, New Zealand, Australia, Europe, places like that. And so we've simply, in some cases, established relationships with Canadian pharmacies where we can have drugs shipped in from Canada, just like mail order, to members' homes. And it's really trying to tackle some of those high-cost branded specialty medications. So some employers that we talk to is like, well, now all my employees are going to get their drugs from Canada. It's no, not entirely, but it's usually about 5 or less than 5% of your population that are driving, a high percentage of those pharmacy costs. So, how can we help those 5% or less and equip them with some of those manufacturer's assistance programs, patient's assistance, or international options? Because when we do that, we can usually reduce the claim by 50 to 60%. And in return, since we're reducing the claim for the plan, again, we're going to share with the savings with the employees. We can get those medications to them at no cost. We had a gentleman that was on Skyrizi, and that was a $500 copay on his Blue Cross plan that he was taking on a monthly basis. And so we were able to waive his out-of-pocket expenses for that. So that's $500 that stays in his bank account that he can, allocate to, taking his family for a vacation or, allocate to his retirement plan and things like that. Same thing on the surgery side of things. As we mentioned, all care is not created equal. And a lot of carriers kind of tout that, hey, we've got this large national PPO network that gives you access to all these doctors and hospitals. But do we really want our employees access to all of the doctors and hospitals? Because unfortunately, there are not so great surgeons out there. There's low quality scores of facilities and things like that. So we can try and direct patients or your members to the highest quality, lowest cost providers. I know Lee shared his example. Bernie's got an example of himself. He's got double hip replacement that he paid half the price for. Myself, I actually had hip impingement surgery 2 months ago, and at our local hospital, the MRI was going to be, I think, $1,800. I called our independent radiology group, and it was going to be $650 through my insurance, and then I asked what the cash price was going to be, and they said $750, and I was like, why is the cash price more expensive than the insurance price when I could just swipe my card today? And they're like, no, we'll give you the $650. It's like, okay, that was easy. I called my direct primary care doctor, he goes, oh no, I can get that for $250. So there's these huge pricing differentials, even with imaging, and we had a gal even, she was going to go get her hip replaced at a brand new, immaculate, multi-specialty orthopedic center, and her hip was going to be $120,000. Where within a 50-mile radius, we could have got that done for less than $20,000. There's even some employers that are doing this thing called medical tourism, where from 122,000 to less than 20,000, there's a huge savings opportunity there. Let's put that person on a plane and have a travel companion. Put them up in a hotel just to get that done at Surgery Center of Oklahoma or another surgery center. It's not uncommon. And then direct primary care, again, just to reiterate, foundationally, we need good primary care. And I'm sure some of you maybe have been to the primary care office, in the last 12 to 24 months, trying to get a visit. I could take up to 3 months, and it's like I'm sick right now, not in 3 months. So being able to get in, same day, next day appointments instead of running off to the emergency room, and then getting into the doctor's office that might have a panel of over 2,000 patients where they have less than 15 minutes with you, and the only thing they really have time for is to write you a new prescription. And not really actually addressing what your chronic condition or whatever you're dealing with at that point. But I'm going to start to wrap up here. Hopefully I shed light on some of these things, just in the industry, whether it's pharmacy benefit managers or direct contracts, bundled pricing, things like that. But I tried to play, both sides, trying to reduce the claims for the employer, but it's also good for the employees because we're trying to seek quality and we're trying to seek, fair pricing, which is good for both the employer and the employees. And in most cases, like we mentioned, we can waive out-of-pocket expenses for the employees when they are taking advantage of some of those solutions. Because unfortunately, a lot of our employees, or just everyday Americans, are running around with unlimited credit cards in the form of health insurance IDs, and they have no clue, the cost and quality, across the board. Why can we get on, Amazon and, compare different books or, energy drinks or things like that, or water bottles to know what the star rating is and, within proximity and things like that, but we can't do, that in healthcare. This is just kind of a joke, but not a joke. Again, just trying to shed some light on some of the items that maybe you've had that a similar gut feeling that I had. Just trying something's just not quite right here. In this healthcare or health insurance world. And I think the strategies exist. The strategies do exist because we are deploying these with a lot of our clients. And it's very rewarding, just being able to reduce costs, add in great things like direct primary care, get employees access to the medications that they need instead of rationing medications because the cost is so high. And we've got testimonials after testimonials, similar ones to Lee, just like I shared with that prescription drug, that people are now being able to put more money into their retirement. They're able to afford the medication that they need to take, or take their family on that vacation that they've been wanting to take, just due to the health insurance costs that they've had to deal with over the years.